As human beings, we all have the best at heart for our country and for patients, and this industry is really passionate about what they do. And even from the tech side, I think it's incredible how we all have the same passion and want to really solve problems from that perspective. So how do we bring AI in? There's still a lot of work that needs to be done to cover the legal aspects, and we're trying to look at solving a small problem with a very low adoption rate. So we need to focus on what the actual patient requires out of this, and how do we then, let's call it, use our tech and the abilities and capabilities solving those problems, so more people have access to those type of services. I think that excites me, that one day we can get there where we all work together to solve a common problem.
What happens when a sector is not moderated properly? There were many parallels that were drawn with the banking sector, which just makes sense for some of those adoptions to be made in healthcare, and it will solve some of the problems that we currently have around being able to identify people, being able to have shared resources in terms of exchanging information, and also creating that collaborative space. There's a lot more room for synergy with some of the people that I met in there. There's a value in that connection and creating a multiplying force in order to get what we're trying to achieve.
We all know that we spend a lot of money on healthcare in South Africa, and the point is, where does that money go? Because it doesn't necessarily correlate with the health outcomes. And so for me, the pressing issue is, how do you best use the resources that we have? Being amongst people from different organizations and who are working to try and solve healthcare problems, and just to hear the thoughts and ideas and how technology can be leveraged to improve health outcomes. It was exciting for me to see a lot of us in our different spaces are having similar conversations around technology in healthcare.
Data is going to be kept from one clinician to the other, or one institution to the other. How are we now going to protect the confidentiality part of it? So hearing what other people are suggesting that they've got, or other problems that we might encounter, hearing all those, it also enlightens one to say, going forward, maybe in our institution, this is some of the things that we can start putting in place. So I was very interested to hear one of the gentlemen who said they've got a call center whereby when somebody else calls, it can detect from a patient's voice if the person very much distressed, categorize it so that they're able to patch or transfer that call. But that brought a little bit of hope, I would say, to say, at least there's something as a start that's been done. Going forward, I don't know if we're going to have robots that will be able to feel the touch, but yeah, for me that was very interesting.
Everyone is willing to embrace technology in general. It might be the nature of the people in the room, with people coming from tech space, but also from the private sector. So there is that overarching willingness to really adopt technology in the day-to-day operations of healthcare, whether it's on the clinical side or the administrative side. I don't think there were delusions in that room about the nature of available data, which is heavily unstructured, which is heavily paper-based and not digitalized. There's no delusion about the infrastructure. There's a clear attempt to link the adoption of technology with what exactly are we solving for in our country. There were many conversations around access, there were many conversations around costs, around quality. So there are many reasons that frustrates the adoption of technology, which then means we are almost starting at a zero base that would allow us massive space for innovation.